Okay, well, thanks for your attention. And now we're back with part two of lifestyle considerations for gout. We'll talk in this segment about specific dietary factors. Previously, we've discussed some of the general themes of weight loss, of diet, of alcohol, and now we're going to get into a bit more detail. So we know that certain aspects of the diet can be detrimental. Um, we know that purines are a precursor for uric acid in human metabolism, but it turns out that trying to change purines in the diet has been difficult to do. But we do know that purines are also part of protein. So increasing the certain types of proteins or decreasing other types of proteins can be useful. And we know that increasing amounts of meat and seafood are significantly increased with the risk of incident gout. And there's been some trials that have suggested that if we can reduce those, we can reduce the risk of future gout attacks. So the source of protein seems to be very important. And we know that soy and non-soy legume ingestion has been associated with a reduced risk of incident gout. So soy sources of protein are better than meat and seafood. We know that the American College of Rheumatology in 2020 put out gout treatment guidelines, and they conditionally recommend limiting alcohol intake, limiting purine intake, and limiting high fructose corn syrup intake. There is a conditional recommendation against vitamin C supplementation. Vitamin C in some small studies has been suggested to maybe reduce the risk of gout flares, but really the data are kind of too weak to make that a recommendation. And there really were no recommendations made for dairy or cherry intake, but I'll show you those data anyway. The certainty of the evidence has been relatively low, but it's important for you to be aware of this because patients will come in and ask you about cherry intake, ask you about dairy intake. And so we think it's important as trust clinicians, as the educators of the patients, to be aware of these issues. So let's again turn our attention first to protein, meat and seafood versus plant-sourced proteins. Meat and seafood intake is well demonstrated to be associated with an increased risk of incident gout, adjusted hazard ratio of 1.41 in the health professionals follow-up study. And those consuming the largest amount of fish had an increased risk of gout compared with those in the lowest quintile, hazard ratio of 1.5. Additional studies in Asians, Chinese persons living in Singapore, show that plant-sourced proteins have reduced the risk of gout. So this is the soy-based proteins. And again, in two Chinese populations in Singapore, total protein intake, mainly from poultry, fish, and shellfish, was associated with increased risk of incident gout, whereas soy and legumes with a reduced risk. So changing the distribution of where proteins come from is important to talk about with your patients. The same studies that have looked at this have also looked at the ingestion of dairy products. And there's been some suggestion that dairy products reduce the risk of incident gout. Not exactly clear why, whether it's a change in the distribution of calories or something that's specifically within lactose or dairy containing products. So in this study, in contrast to meat and seafood intake, the highest quintile of dairy product consumption was associated with a reduced risk, 50% reduction in incident gout. And some people have tried to pursue randomized trials, but these are really very difficult to pursue around most of these products. Cross-sectional studies have suggested an inverse relationship between dairy and milk product intake and serum urate. So more dairy milk, less serum urate. How about carbohydrates? The recommendation is to limit or avoid sugar-sweetened beverages or beverages that contain high fructose corn syrup. Really, any sodas. A lot of fruit juices are sugar sweetened, and so you have to be careful about those. These are, very good recommendations, not just for gout, obviously, but also for reducing the risk of diabetes. And considerable interest has been directed to the role of high intake of simple sugars, fructose, sucrose, and that are found in a lot of sugar-sweetened beverages, as well as apples, raisins, oranges, as risk factors for incident gout. There has been a study on intake of simple sugars that suggested that those in the highest, as well as the lowest quintiles, were found to have an increased risk of incident gout. So that's kind of interesting. There's also a whole literature, and if you Google this, you'll see cherries and gout go together. Lots of people drink cherry juice, eat cherries as a way of trying to reduce the risk of gout. There have been some smaller observational studies that suggest this, but really no randomized trials. However, it's a commonly asked question by patients with gout, and as a gout clinician, I think cherries are fine. I don't think there's a danger. I'd say, if you want to have a handful of cherries a day, that's not going to harm you, and it may reduce the risk of gout, but the data are weak. Vitamin C intake seems in some studies to have a mild but persistent urate lowering effect. We don't recommend, taking huge amounts of vitamin C supplementation. And again, I mentioned that the American College of Rheumatology did not recommend towards vitamin C. So this is kind of a weak suggestion, but I do have patients that come in asking me about vitamin C and multivitamins, and these are generally thought to be safe if not taken in mega dosages. How about coffee? You find this on the web, that people who drink more coffee have a reduced risk of gout, and there are some observational studies along these lines. I don't think that patients should start drinking coffee who don't drink it, but they should not worry if they do drink coffee. Coffee, if anything, seems to have a reduced risk. The reduction risk was slightly less with decaffeinated coffee and was not shared with tea intake. How about fish and omega-3 fatty acid consumption? We talked about how fish may actually be a poor source of proteins and may increase the risk of gout attacks. But omega-3 fatty acids, we know, have an anti-inflammatory property. And we've seen this in studies in other inflammatory arthritides like rheumatoid arthritis, that intake of omega-3 fatty acids reduces the risk of arthritis. So one study suggested about a 25% reduction in the risk of a gout flare in patients who use N3 polyunsaturated fats or omega-3 fatty acids. There's some limited evidence to suggest that a whole diet approach, the Mediterranean diet or other types of diets, are better than thinking about one component in the diet. And there's some data around the DASH diet. The DASH diet was developed by some people at Harvard who were looking at how diet might affect blood pressure. So the dietary approach to hypertension, or DASH diet, was developed. And when patients follow this diet, it's very difficult to follow. They can both reduce their blood pressure and their serum urate, and therefore their risk of future gout attacks. But it's pretty intensive diet. And again, we're not in the business and trust of changing people's whole diet, but patients can read about it. Some patients will be very interested in the DASH diet, and it's worth being aware of, as well as the typical Mediterranean diet, which focuses on plant proteins, whole grains, fish, and use of monounsaturated fats, olive oil, etc. It's been associated with a lower likelihood of elevations in uric acid and thus a reduced risk of future gout attacks. I've talked about factors that might be associated with serum urate, etc., but there are factors that are triggers for gout flares. It's a little bit different than factors that may cause elevations in serum urate, but there's some overlap. And as I've said several times, most gout patients can identify factors in their diet, alcoholic beverages, etc., that may trigger a flare. And so these are important to query patients about. Can you think about the last 5 gout flares you've had? Do you remember certain foods that came before the foods? Was there seafood? Was there beer? Was there other types of triggers that might be important? And most patients will be willing to change what they're eating, changing some of these lifestyle factors if they can reduce the risk of a gout attack. So again, seafood, fatty meals, alcohol, etc. Alcohol, we talked about just briefly, but we know that in patients with established gout, that reducing alcohol intake is important, again, because of the trigger. As well, it does reduce their serum urate by a little bit, but every little bit is important. So reducing alcohol intake is important. In patients with established gout, beer, liquor, wine were all associated with an increased risk of gout flares. So I really talk about drinking, reducing the risk of gout flares by reducing the risk of alcohol. If a patient has a drink 2 or 3 times a week, can they cut it back to once a week or even stop drinking altogether? These are important, and the data are all shown here. We know that tophi, which is a very severe manifestation of gout, these are the monosodium urate deposits that we can see over extensor surfaces, sometimes in the ears, sometimes in the finger pads, that we can reduce the risk of tophaceous gout by reducing the consumption of liquor and other forms of alcohol. And that's been shown in this study that I'm showing you data on here. So in summary, the long-term goals of therapy in patients with established gout are to prevent recurrent gout flares and disease progression. Patient education is so important in patients with gout and in the TRUST trial. The asymptomatic interval between or outside of a gout flare is the preferred time when we try to do that education. And we try to talk about their history, co-medications, comorbidities, lifestyle factors, diet factors, alcohol intake. As I've talked about, there's many known modifiers of incident gout risk, certain medications, thiazide diuretics, as well as diet, etc. We know that reducing weight is critical, and so being able to counsel patients that are in the TRUST trial about weight reduction is going to be critical. Diet composition is an important factor. Reducing the meat and seafood sources of protein and substituting them with other sources of protein, soy, plant-based in general, dairy, is useful to be able to discuss with patients. Again, things like the DASH diet and the Mediterranean diet are important to be aware of. Patients will be interested in this, and counseling them will be helpful. The need for weight loss is going to be critical, and being able to discuss that with patients, allowing or asking patients to keep diaries of their weight between the visits in the TRUST trial is going to be very useful. And then, as I began the first talk with, comorbidities and co-medications, hypertension, diabetes, heart disease, the use of diuretics, the use of low-dose aspirin. These are all critical, but our goal in TRUST is not to change around a patient's medication regimen. That would be inappropriate. We want to educate patients. At times, we may want to contact the primary care doctor to consider changes. But we are not going to institute changes in their medication regimen outside of the study drugs that you have learned about or will learn about in other discussions. So with that, I'll close and look forward to further discussion about these issues. Thanks very much for your attention.